As Alzheimer's disease progresses, daily tasks such as getting dressed and brushing teeth can become difficult for the person affected. If you are a caregiver, it's important to find a balance between helping them maintain their independence while also ensuring their safety. Here are some tips to make daily care routine easier. Keep things simple and flexible to accommodate their changing abilities. As Alzheimer's disease progresses, it may become harder to handle personal tasks. In the early stages, you may still be able to manage on your own, but as memory loss worsens, it can become difficult to do things independently. In the middle stages of Alzheimer's, you may struggle with tasks like preparing meals and choosing appropriate clothing. As cognitive decline becomes more severe, you may require assistance with personal care, such as bathing, grooming, and using the bathroom. Someone with Alzheimer's disease may find it frustrating to accept help, and caregiving can be emotionally challenging. Here are some tips to make day-to-day living easier. Stick to a routine to help the person feel secure and to save you from having to get organized every day. Consider doing certain activities at a particular time of day when the person is at their best. Encourage independence and allow the person to do as much as they can for as long as they can. Respect their privacy and personal space, and be gentle when helping them with personal care. Keep things simple by breaking tasks into steps and giving only 1 or 2 specific instructions at a time. Be flexible and adjust to their good and bad days, as their interests and abilities may change over time. Mealtime can be challenging for someone with Alzheimer's. They may forget to eat, not recognize food, or struggle with chewing and swallowing. To make it easier, have them eat at the same time and place every day. Limit distractions and use simple table linens and dishes. Give them choices, but stay away from open-ended questions. Use adaptive utensils and serve bite-sized portions. Consider a meal delivery service for easier mealtime. Try not to stress if they make a mess and don't turn eating into a battle. Bathing can be scary or uncomfortable for someone with Alzheimer's. To make it easier, schedule bathing for a normal time of day. Let them handle it themselves for as long as possible. Give them control over choices like whether they take a bath or a shower. Simplify the process by setting out supplies ahead of time. Have a plan if your loved one becomes agitated. Adjust your expectations and consider a home health aid for bathing. Getting dressed can be a signal to your loved one, and it's important to make this task easier. Give them a choice between a couple of outfits. Lay out their outfit in the order they need to put them on. Look for easy-to-use clothing and non-slip shoes. Be okay with them wearing the same outfit every day if that's what makes them comfortable. Let go if they choose a mismatched outfit, but make sure they're dressed for the weather. Tooth and gum problems can lead to mouth pain, so it's important to make dental care easier for your loved one. Look for easier-to-use dental care products. Try brushing alongside your loved one or use a long-handled brush. Grooming is important for maintaining a sense of normalcy for your loved one. Use their normal personal care products and get safer grooming tools. Find a hairdresser who will come to you if trips to the salon become stressful. Toilet use can be challenging for someone with Alzheimer's, so it's important to make it easier for them. Put toileting on a schedule and make it easy to find the bathroom. Be mindful of safety and consider a portable toilet or urinal for nighttime. Balance privacy with safety and accept that accidents will happen. When caring for a loved one with Alzheimer's, it's important to remember that they may have difficulty cooperating with their personal care. This can lead to agitation, especially if they feel pressured to do something. As the disease progresses, their communication skills may also deteriorate, making it harder for them to express themselves. To communicate more effectively, stay calm and use a gentle tone. Speak slowly and clearly, and maintain eye contact. Be patient and allow them time to respond without interrupting. Use gestures to demonstrate tasks, as they may be able to follow along. Pay attention to their body language and encourage them to use gestures or point. Consider using written notes, as some people with Alzheimer's may find it easier to read than to understand spoken language. It's also important to take care of yourself and seek support when needed. Consider arranging backup care to give yourself a break, and look for a support group to connect with others who understand what you're going through.